Thank you, everyone. I appreciate all of you being here and making time for this presentation. My name is Tabari. I'm the Training and Exercise Coordinator for Southeastern Idaho Public Health, and I will be your host and facilitator for this meeting. On the next slide, we'll just go over our agenda. So we will cover the introduction first, and I just did part of that. The other part of the introduction is including our house rules, just some housekeeping rules. So we request that your microphone be on mute and that you have your video turned off. That way anyone joining the presentation has a good quality experience and view of the presentation being conducted. So yeah, just to go over it again, please have your microphone and your cameras turned off. And then if you have any questions, you can use the raise hand function and I will get to you. Thank you. Next up in the agenda, we will just be going over what the community lifelines are, why they're used, and how they're used. Afterwards, we will put our learnings into an example, and then we'll go over Q&A, and then I will have another slide for some resources you can use if you'd like to learn more about the lifelines themselves, and then our closing comments. And so moving on to our next slide, and this is where we ask, what are the community lifelines? So the community lifelines are a framework that was developed by FEMA, and FEMA is the Federal Emergency Management Agency. FEMA is kind of the broader level entity that coordinates preparedness and response activities at the federal level. And the community lifelines are a framework that was developed by FEMA, and they consist of the 8 vital services in a community that help all other aspects of society to function. These 8 vital services are an integrated network. They're the assets, the services, the capabilities that are used every day to support the needs of the community. And when one of these 8 vital lifelines is disrupted, important decisions must be made so that possible harm to the community is reduced and the lifeline is restored to normal. During these the efforts to restore or reduce harm in a lifeline, sometimes access and functional needs group, their needs may guide how the restoration efforts are prioritized. An example I can give of that is if there was a power outage and if you have a population that is perhaps dependent on medical devices that need electricity, in some cases, the needs of those groups may guide some priorities with restoring power should the power go out. On this slide, we will go over what the 8 community lifelines are. So these lifelines include communications, food, hydration and shelter, transportation, hazardous materials, health and medical, water systems, energy, so that includes power and fuel, and then safety and security. So you may notice that kind of and I'll use the laser pointer for this, hopefully this works. So the food and hydration and shelter lifeline and the water systems lifeline. So you'll notice that this uses hydration specifically, and this refers specifically to water systems. The water systems is a newer lifeline that was meant to represent the water sector. This was done in August 1st, 2023, so about a little bit more than a year. And this was done in a collaboration between the Environmental Protection Agency, so the EPA, and FEMA, so the Federal Emergency Management Agency. There is also a specific and separate training about the lifelines, the community lifelines, that is available on the FEMA website, but the current version of that course does not include the water systems lifeline just yet. Moving on to our next slide, we will go over the components that are included in each of the lifelines. And then over the next couple of slides, I'll just be like kind of zooming in. into each of these components and just going through them with you. And also another note is that each of these components also have subcomponents. This presentation will not go into that level of detail. However, one of the resources that will be included near the end of the presentation will have kind of a toolkit from FEMA about these lifelines that you can find out more information about. So this lifeline in this slide is about safety and security. Your safety and security includes law enforcement, fire service, search and rescue, government services, community safety. The following lifeline, which is food, hydration, shelter, that just includes kind of exactly what it entails. So you have food, hydration, shelter, and agriculture. After that, we have health and medical, which includes medical care, public health, patient movement, medical supply chain, and fatality management. The following lifeline is energy. So that includes your power grid and fuel. And then we have communications. So that includes your communications infrastructure, responder communications, alerts, warnings, and messages, finance, 9/11, and dispatch. The next slide, we cover the transportation lifeline. So that includes your highways, roadways, motor vehicles, mass transit, railway, aviation, and maritime. Next up, we have hazardous materials, which includes your hazmat facilities, hazmats, pollutants, and contaminants. And then we have water systems, which is the newer lifeline that was implemented about a year ago. This includes potable water infrastructure and water systems. So why do we use them? Why do we use the community lifelines? So they were intended and developed to increase effectiveness in disaster operations and help agencies to respond to disasters by characterizing an incident and establishing priorities. So this basically is a tool in helping emergency operations, and it helps us understand what is happening, why it's happening, and what can we do about it. The lifelines are also a way to present, understand, and communicate information in plain common language and visuals to everyone involved in an incident. I will also add that while the lifelines were developed to support response and planning operations, the concept of the lifelines can be applied across the entire preparedness cycle. That includes preparedness, mitigation, response, and all the other aspects. Efforts to protect lifelines, prevent and mitigate potential impacts to them, and building back stronger, more resilient communities will help all other aspects of the community. On the next slide, we'll go over how we actually use the lifelines. So going over each of the lifelines, we go through step one, which is on the left-hand side of the screen. So that includes assessing the lifeline through 6 criteria. So we assess the status. So that includes like what is happening in the lifeline. So a summary of the root cause of disruption. Then we go over impacts. So your impacts are the current disaster impacts to these specific communities, disaster survivors, and response operations. Then we go over actions. I will also use the laser pointer for this. Maybe it'll help. The actions go over the actions that are being taken to address the disruptive services. We have limiting factors. So this is just where we include like what gaps are there, what is preventing a lifeline or a service from being reestablished. And then where it's possible, we include an estimated time to status change. So what time frame can we expect when the disruption or a change in the lifeline condition can be expected? Sometimes this last criteria can be a little, it can vary a little bit because you can have an incident that perhaps occurs over a long time, such as like during during the heat that we experienced in our jurisdiction. We did set up cooling centers, so that was just kind of based on um, how the weather changes and what conditions are there and when they can change. Afterwards, we go through step 2. So step 2 is where we assign each lifeline a condition. And so your condition is represented by the following colors. So a lifeline's condition may be assigned gray when we do not know the extent of disruption or impacts to the lifeline. A lifeline can be assigned red, which means significant impact. And so this is when there are severe challenges or obstacles that are just hindering the resource and the services that we are looking at in the lifeline, and that requires more immediate attention to the immediate attention and resources to restore functionality of the lifeline. And then a lifeline can also be assigned the condition of yellow, which means moderate impact. So moderate impact can mean two things. So one, it could mean that the disruptions or limitations to the lifeline um, that they exist, and it can also mean that the restoration of the lifeline is in progress. And then we have the condition of green. Green means minimal impact. When a lifeline is considered in the green category, it means that it is functioning at pre-incident levels only with minor disruptions. Next up, we will go through an example scenario. So this example scenario is mainly about flooding, and this incident takes place in the imaginary city called Lavender City. So on this first bullet point, we have, so this is on 8/01/2024, so that will be the 1st of August. So on the 1st of August, we have heavy rainfall for the past several days that has been impacting Lavender City. A flood watch was issued by the National Weather Service, while minor flooding occurred in areas like some roadways and some ground level parking lots. So this is on the 1st of August. This is the scenario as of the 1st of August. On the 3rd of August, so a couple of days later, we have the continued heavy rainfall. And perhaps as a direct condition and a result of the heavy rainfall, we have a flood warning that's been issued. And then the primary road for accessing the only hospital in the city is flooded and detoured. And then we also have internet and phone communications that have been impacted. And so these communications are down in heavily flooded areas. Since this is a fictional scenario, I've tried to keep it very surface level, very, very basic to help reduce some of the complications and the complexities that occur in real life scenarios, and just to give you an example of how we can use the lifelines in the next slide. So for the date of the 1st of August, where we had the heavy rainfall and we had some minor flooding on some of the roadways and waterways, the lifelines might be represented on this day as kind of green across the board, except transportation. So your green across the board would just mean that in general there are minor or no disruptions, and then your yellow would mean that there are disruptions or that it is being restored. However, a couple of days later, when we move to the 3rd of August, where we have still the heavy rainfall, and we have some flooding that is occurring in especially in accessing the hospital, where your roads are flooded and detoured, and your internet and your phone communications are down. For that day, your lifelines might be depicted like this, where we have some green lifeline conditions, and then for your health and medical, it could perhaps be yellow, or depending on how bad it is, it could even be red. And then your communication, since they are down in some affected areas that could also be considered yellow. And since the road going to the hospital is flooded and detoured, and also some of the roads even previously in a couple of days ago where there was some minor flooding, this could potentially be yellow or red. So overall, the lifelines capture kind of a snapshot in time. Situations can change, and then the conditions of your lifelines can also change. So before we go into the summary, I will actually go over what we use at Southeastern Idaho Public Health. So like how the lifelines might look in a report called a situational report when we use it. Just give me a moment. Let me pull up the other shared screen. Can everyone see my screen here?
Yes, we can see it.
Okay, thank you. So this is what a template for ours would look like. And so going into the template, you will just see kind of what we already covered. So we have how the status is determined, and then kind of what is assigned in terms of the colors of the gray, red, yellow, greens, and then how they assess the lifeline, and then this is how it might look filled out. So all the information we covered would just kind of go into like the status, the impacts, actions, limiting factors, estimated time to status change. This is how it would look for our version of the situation report. And so I just wanted to show you that just as an example of how these lifelines are used. Further down the document, there are more detailed information, but we will not be getting to that depth for this presentation. We will go back to the previous presentation I was doing. Just one moment. And so after covering all that material, we're approaching the end of the presentation. So I'm just going to wrap up kind of with a summary here. So overall, the Lifelines framework is an integrated network of 8 vital services in the community that help all other aspects of society to function. This framework was developed to make emergency operations more efficient, characterize incidents, and provide a common usable language for everyone involved. Each lifeline status is determined by using 5 criteria, and then each lifeline is assigned a condition using one of 4 colors. And as I've mentioned before, the lifelines capture a point in time status of the incident. And with that, I believe we've approached the end of the presentation. Does anyone have any questions, any feedback? And you can also use the QR code that you see on the screen here to go to a survey where you can also provide feedback. And I understand maybe not everyone feels comfortable just asking questions in a public forum, but that is another option for you if you'd like to use that. But yeah, if anyone has any questions, I'm happy to try and answer them.
I have a question, maybe a question and a comment. This is Josiah. I work with a
Yeah.
veterans home. As far
Oh, yeah.
as coordinating that information when there's a potential community risk of some sort, um, how will we usually receive these reports? Is it all sent through like an email base? Is there like an app that we should log into? Is there anything like that specifically to gather the details?
That is a great question. So usually this information is gathered, one, usually when an incident happens. And then this information is just gathered largely from the community, so your community representatives. Usually, we work closely with emergency management in each of our counties. So, and since our jurisdiction is within like the 8 counties, usually we'll be coordinating, depending on the scale of the incident, we'll be coordinating with the county emergency managers and our in-house SIPH preparedness team and our policy group be coordinating with everyone. And then after we gather that information, it is put into the report. And then everyone who's involved as part of the process will usually be receiving a report in the form of usually an email. And then I'm sure there have been times when maybe it's easier to collect the information with a survey because it's less, slightly quicker, it's less invasive. You don't necessarily need to hop on a meeting for it. But yeah, there's just a couple of ways to go about it. Does that help answer your question?
Yeah, no, it does. I'm trying to remember because I know that I've seen some of these reports that have come through, I think specifically related to COVID, but don't usually hear about much of anything else. And so I don't know if it's because the risk factors are minimal, and so we don't see it. It only arises like if there's greater concern. Would we see something like that for air quality, for fires in the area, for anything like that?
I could speak to that a little bit. I'm Lori Peck. I'm the preparedness planner for Southeastern Idaho Public Health. The template that Tabari showed earlier, I and the other planners from the other health districts spent the better part of last year developing that template. So kind of incorporating those lessons learned from how the lifelines were reported on in COVID, just to try and kind of standardize that across the health districts. So that template is going to be something that we primarily use, and we can use it internally. We can share it with our partners. If it is a larger scale incident, that's usually something that the emergency managers are going to be handling and putting together, and probably a little bit closer to the regular FEMA, if not exactly the FEMA templates. And we can drop the link to the Community Lifelines toolkit that shows what that formal FEMA template looks like. So it kind of just depends on the situation. We may be funneling that information to emergency management and then distributing it. But if it is something that is affecting our local partners, that we're working directly with them in an emergency response, then we would kind of set how we are to distribute that to the partners who are involved in the response. So it's not like an app or anything. We're not that fancy, but we can distribute those. So and while we have all of the lifelines on there, a lot of that is going to be the stuff that is directly relating to public health. So like the transportation affecting being able to move patients, being able to receive supplies, things like that. So a lot of ours is focused on that. So it just depends whether it is something that is involving our partners. But yes, this is kind of evolved from the way those were reported on in COVID. And we haven't had something to that scale yet, but we have had some kind of internal things like with our responding to the extreme heat and doing our cooling centers that we've been operating. We've been using this template internally, and we will be able to share some of the information that came from that. So
No,
the short answer is still it varies. Is that a little bit more
it's
context?
helpful. Yeah, my curiosity is just to see how we can gather that information and obviously learn from it. Oftentimes with the reporting functions that we have as well, it requires that if we do like a community-wide scale of some sort, um, where we have an incident that happens, if there's reporting that comes back from it, we can add that information into our files so that when we have our compliance surveys, we're able to go ahead and share with them what we're doing from an emergency preparedness standpoint. And I think I've seen a lot of that. I was looking to see in my emails if I had received some of that information. I couldn't find it, but I recall seeing some of the stuff during COVID. So it's been helpful. I appreciate that.
And we did kind of go over the template a little bit in the communications plan presentation that we did a couple months ago. And that full presentation is on our YouTube. I would also be happy to send you this template that we are using so you can familiarize yourself with it. And if you want to go ahead and adapt it to whatever use you have, I'm happy to share that.
No, that'd be great. I'll put some comments in there with that feedback survey so that you guys have my contact information.
Perfect. Thank you. Thank you very much. Are there any other questions? Okay, I'm hearing none. Over on the next slide, we have some of the resources that we were referring to during the presentation. So first off is that Community Lifelines implementation toolkit from FEMA. And then if anyone would like, you can also just like put it in the chat that if you'd like to receive a copy of these slides, I'm happy to send those out. But if you also Google the Community Lifelines implementation toolkit, you should find that from FEMA as well. And then this is the course we were talking about. This is thank you, Lori. This is a free course from FEMA. They're called the Independent Studies. So that's what the IS means. And then you just take this course if you'd like to familiarize yourself with the Community Lifelines. I will say though that the last time we checked, that Water Systems Lifeline has not been included yet in this. So maybe in a newer implementation of it, a newer iteration, they will be including it. And with that, I would like to thank you for your time. Thank you for being here. This was the Public Health Preparedness team at Southeastern Idaho Public Health. That includes the three of us. So that includes our program manager, Paige, our preparedness planner, Lori, and myself. I'm the training and exercise coordinator. And with that, we can just wrap things up. This took a bit less time than we expected, so I'm happy to give you the rest of your day back. Thank you very much for being here. I appreciate you. Thank you.
Thank you, guys.